Today, we're going to be going through the different types of assessment we have for stroke. There are two different types of assessment that we are learning for stroke, and that is the Cincinnati Pre-Hospital Stroke Scale and also the FAST technique. So we'll start off by going through the Cincinnati Pre-Hospital Stroke Scale, which is commonly known as the CPSS. It is used to diagnose a potential stroke in a pre-hospital setting through testing the following three signs. If any of these tests show abnormal findings, the patient may be having a stroke and should be transported to hospital as soon as possible. Patients with one of three of these findings as a new event have a 72% probability of an ischemic stroke, while if all three findings are present, the probability of an acute stroke is greater than 85%. The Cincinnati Pre-Hospital Stroke Scale is assessed by checking facial droop, arm lift and speech. For facial droop, the patient is instructed to smile. In a normal and asymptomatic stroke, the patient will have both sides of the face move equally. An abnormal result shows one side of the face does not move well. This will be demonstrated for the following actions. This is for normal, and this is for abnormal. The next one we assess is arm lift. I will instruct the patient to close eyes and extend both arms out straight for 10 seconds. In a normal result, both arms move the same or not at all. In an abnormal result, one arm does not move or droops down, or does not just come up at all. We then assess the patient's speech. We ask the patient to say a statement such as, "You can't teach an old dog new tricks." In this, we'll be looking for any slurred words, and an abnormal result is slurred words, saying words wrong, and unable to speak. Another way to assess this is by asking the patient to say hello and their name. We'll then be assessing by the FAST technique. The FAST technique is meant to be a very quick test that is done in the moment of stroke to assess if it is possible. We firstly check the patient's facial movements. We ask the patient to smile and show teeth. We look for any lack of symmetry, any grimace, or any obvious facial asymmetry. We also look for their arm movements. We ask the patients to lift arms together to 90 degrees if sitting and 45 degrees if supine, and ask them to hold the position for 5 seconds and let go. We are looking to see if one arm droops down or one arm drops dramatically when the test is over compared to the other. We then assess the patient's speech. We'll have the patient attempt to have a conversation, and we'll also check for any disturbance of the speech to see if they check any companion, and also if they have any slurred speech. We'll also look for word finding difficulties and to see if they can name objects around the room. We'll also be checking to see if there is any severe visual disturbances and to see if they can also name that. There is also many other signs of a stroke, and the following are weakness or numbness or paralysis of the face, arm or leg on both sides or one side, difficulty speaking or understanding, dizziness, loss of balance or an unexplained fall, loss of vision, sudden blurring or decreased vision in both eyes, headaches, usually severe and abrupt onset or unexplained change in the pattern of headache, and also difficulty in swallowing. Thank you very much for watching the video.